Hello, my name is Milk. I'm going to start teaching normothermia this session. And what is normothermia? We can just guess from the name of the title, normal, and thermia, we can say temperature. So we are going to learn about the normal temperature, how we're going to maintain the normal temperature for the pre-op patients. Um, I'm going to cover these sessions with start with the background and a couple of definition and any risks of the preoperative hypothermia, and also how we can implementing this warming blankets. So background, we have a surgical patients in our ward, and all the surgical patients are at risk of developing hypothermia at any stage of the preoperative pathway. And preoperative hypothermia is very common, but we can preventing this incident. And also this, if we preventing this hypothermia, and we can preventing the further complications. We're going to through again, but importantly, wound infections and bleeding and transfusion requirements can increase, and also duration of the hospital stay is getting longer, prolonged, and also high cardiac issue and pain. You can imagine patient who is really cold and shivering, and these complications can risk more higher for the patients. So a couple of definitions, we know that, but I'm just going through. Preoperative means we have 1 hour before the induction of anesthesia, and we have the postoperative patients, and which means 24 hours after entering into the recovery area. So hypothermia is definition is a patient core temperature of the below 36. We are aiming for comfortably warm temperature, which means between 36.5 and 37.5. We are expected normal temperature range of the adult temperature. So I mentioned the core temperature. Core temperature is the blood or internal organs actual temperature, but we can't measure this core temperature in our ward. So we have a direct estimate of a core temperature we can measure in a sublaryngally or axillary. So preoperative time is very important to assess any risk of the preoperative hypothermia, and then we can preventing this issue. So that is a very crucial time. When we apply for the blankets for the patients, we need to advise for the patients first. Patients should be aware this risk of the hypothermia. And some patients, they don't think about the pre-op because they don't know what's going to happen in the theater. So we have to just reinforce and explain. And stay warm before the surgery will lower the risk of post-operative complications, and they will understand and accept. And hospital environment can be cooler, especially in theater. And also when they preparing for the operation, temperature can be low very easily, especially when they take all the clothes off and for the preparing the surgery. Those are things that they don't expecting and they don't know. So as our staff, or we should explain. And I met one of patients saying that, oh, I'm warm enough, I don't want to even blanket. But when you explain the reason of we try to aim for the comfortably warm temperature, especially more around the 37 above, that really helps for later actual temperature, their body temperature go down in the theater. We are really preparing for them. So that's teaching is very important. And patient at higher risk of the preoperative hypothermia, NICE guideline is in there for this categorized, and if there's more than 2 categories apply, that's the risk of any hypothermia, preoperative hypothermia. But I will go through with our criteria. And so risk of preoperative hypothermia, that's really important. So I mentioned the definition of the hypothermia is the core temperature is less than 36. So many patients, surgical patients, who 50 to 90% of patients actually can get the hypothermia. And because of that, it's an increasing risk of the prolonged hypospiral state, and it affects the coagulation of the disorders so that its bleeding is more higher, and cardiac issue can be also thin, and delayed wound healing is also costing NHS more money. And importantly, we wanted to decreasing the infection risk, surgical site of infections risk is really increasing because of the hypothermia. So we really wanted to focus on maintaining zero amount of numbers of patients in our trust to have the surgical site infection. So we introducing this warming blanket for preventing hypothermia. So measuring the patient's temperature, I mentioned earlier, we measuring the estimated core temperature and preoperative warming. We should aim for the above 36, 36 of the body temperature. And warming blanket should be started preoperative in our ward, and the warming blanket should be maintained through the patient's each steps of the surgery. So we apply the blanket, and then they can also use it in the theater, partially upper body or lower body, some partial area of the body to keep them warm, as well as after finish the surgery, they can use in the recovery. We would like to expect this warming blanket come back with the patients. Our trusted blanket guideline is clearly mentioned that apply the 1 hour before the surgery, and also ensure vital signs including temperature are completed immediately before the application. And our criteria of the warming blankets, including all patients who has the ASA above 2 and above. I will explain the later as well, this ASA score, next slide, and also including all hip fracture patients, all total hip replacements, elective plus, as well as trauma patients. So we are the trauma patient. All hip replacement patients should have the blankets. Or total knee replacement, also all periprosthetic fractures, all distal femurs, and major surgery, spinal surgery included. I can explain further about the ASA, which is American Society of Anesthesiologists. This physical status classification system helps actually noticing who has the preoperative high risk. But we are going to use this one as well. So ASA score 1 is a normal, healthy patients. Healthy, non-smoking, no or minimal alcohol use. But already ASA 2 is a patient who has a mild systemic disease, such as well-controlled diabetes, hypertension, or mild lung disease, and social alcohol drinker or pregnant or obesity. Those already score 2. So we aim for the patients who score 2, ASA score 2 and above. Anybody can use it. If you have a doubt, trust want you to use the blanket. So their trusted guidelines exclusion of the blankets mentioned that all injections and all hand surgery, such as we have the little infection of the fingers or the washouts and minor finger fractures, all foot and ankle surgery, such as X-fix or ankle ORIF, and very simple surgery, less than 30 minutes durations, we are not recommending to use it. But if you are doubt, use it. So how to use this easy warming blankets is very simple. This is a vacuum sealed pack. You can just open and tear and remove the package. As soon as you remove this package, exposure to the air is starting to warm. And we open it, unfolding it, and then when this blanket is exposed to air, it's activating temperature, it's getting warmer in 30 minutes. Around 10, 12 pockets there, and that contains warming pads, which is salt iron powder, and that's lasting for 10 hours. So it will help the patients to maintaining the warm for 10 hours. Patients, this easy warming blankets, we have to put that pads facing up, and also no extra weight should be adding on top of the blanket. So for example, people are confused with the sheets and blanket. We should use it on top of the sheets or on top of our blanket. So this warming blanket should be visible, and patients' hands even should be under the blanket. During the pre and post-operative period, this blanket has to be used and keep it flat, not folding. So basically, we should use this blanket with the trained staff and place the blanket on top of the patients. I mentioned the warming pads should be facing up. There's a written, printed sign is this side up. On the marking on the blanket should be visible. And when we use this blanket, shouldn't be folded because this warming pad can be a little bit more hotter. So it's not going to causing the fire, but when we're using, we have to use a spread. So when, for example, when patients go to toilets or going to just stand up, you just lift it up and then put it on the chair and then like not folding. And then when they come back, we can put it all back to the patients. I mentioned clearly no extra weight or pressure on top of the blanket, and it's 18 above. So precaution-wise, anybody who has a severe impairment of the peripheral circulations, we shouldn't use. And it's not our our ward, but somewhere like a oxygen-rich environment, they shouldn't use it. And these warming pads, we shouldn't use it with the MRI or X-ray. So patients shouldn't go with this blanket. And especially we have to watch out the patient who has a pain patches or any Parkinson patches that causing increasing the drug delivery because of the getting warmer and then circulation is faster. So we shouldn't use it. This video is showing clearly mention every steps of why we're using these blankets, and I will link this video after this session. Post-operative praises, we would like to aim for the patient still temperatures above 36. And in the recovery, they are really using their Air Force warming machines and extra to maintain the patient's temperature warm enough aim for the comfortably warm temperature. So when patients arrive in our ward, we have to get handed over from the patient's temperature from the recovery staff, and also we checking every 30 minutes, which we do. And I hope the warming block can come back to our ward when we send the patient with that. So thank you so much. And also I will share the video, and also I will share the quiz, and there will be prize. If you can participate, that will be great. Thank you so much.